Hello, Dr. Mike here. Did you know that over 400 million people worldwide have diabetes, and about half of them don't even know it? That's right. We're talking about a silent condition that could be causing irreversible damage to your body right now, without you even realizing it. Today I'm going to reveal something few doctors share with their patients. There are 5 seemingly harmless signs that could indicate dangerously high blood sugar levels. Signs that most people completely ignore. If you or someone you love is over 40, this might be the most important information you'll hear this year. Stay until the end, because at the 5th symptom I'm going to share a tip that literally saved the lives of dozens of my patients. The hidden danger of diabetes. Before I talk about these warning signs, let me explain why undiagnosed diabetes is so dangerous. Think of excess blood sugar as tiny shards of glass circulating through your veins. Over time, they damage everything they touch: your kidneys, your heart, your eyes, your nerves. The worst part? This damage happens silently, often for years, before obvious symptoms appear. When I worked in the emergency room at Memorial Hospital in Chicago, I saw hundreds of patients come in with serious problems that could have been prevented if they had recognized the early signs of diabetes. One of them was Robert, a 58-year-old teacher who thought he was perfectly healthy until he suffered a stroke. His blood sugar levels were 3 times above normal, and he had never done a simple test to check. Robert's story isn't unique. In my 20 years of medical practice, I found that most people with type 2 diabetes had the condition for 5 to 7 years before the official diagnosis. That's 5 to 7 years of continuous damage that could have been prevented. So, let's get to the point. Here are the 5 seemingly harmless symptoms that might mean you have dangerously high blood sugar levels. Symptom 1. Constant thirst and dry mouth. Do you find yourself refilling your water glass several times throughout the day? Do you wake up in the middle of the night with a dry throat, desperate for a sip of water? Most people dismiss this as a harmless habit or believe they're just being healthy by staying hydrated. But let me tell you a secret. Excessive thirst, what we call polydipsia in medicine, is often one of the first signs that your body is struggling with high blood sugar levels. Here's what happens. When there's excess glucose in your blood, your kidneys work overtime to filter and absorb all that sugar. When your kidneys can't keep up, excess sugar is excreted in the urine, taking fluids from your tissues with it. This leaves you dehydrated. Dehydration, in turn, triggers the thirst center in your brain. It's like a vicious cycle. The more sugar in your blood, the more water your body loses, and the thirstier you feel. It's your body's way of crying for help. Sarah, a 62-year-old patient, came to my office complaining that she needed to drink water like a camel in recent months. She thought it was just a side effect of aging or perhaps the dry weather. A blood test revealed that her sugar level was 210 milligrams per deciliter, well above normal. With proper treatment, her thirst returned to normal in just 2 weeks. If you think you're drinking more water than normal, don't ignore it, especially if it comes with the next symptom on our list. Symptom 2. Frequent trips to the bathroom, especially at night. Speaking of drinking a lot of water, let's move to the second warning sign: frequent urination, or what we call polyuria. Have you noticed that you're going to the bathroom much more frequently? Particularly, have you been waking up in the middle of the night to urinate when this was never a problem before? Many people think this is just part of aging or a consequence of drinking more fluids. And yes, sometimes it is. But when combined with other symptoms on this list, the constant need to urinate can be a telling sign of elevated blood sugar levels. As I mentioned before, when there's excess glucose in the blood, your kidneys work double time to get rid of it. This means producing more urine, much more urine. It's your body's way of trying to dilute the sugar and eliminate it. A study published in the Journal of Diabetes Research showed that up to 87% of people diagnosed with type 2 diabetes reported increased urinary frequency in the months prior to diagnosis. Michael, a 54-year-old lawyer, came to me because he was tired of waking up 3 to 4 times a night to go to the bathroom. He thought it was a prostate problem, common in men his age. He was surprised when we found out it was early diabetes. With diet changes and exercise, he managed to normalize his blood sugar levels and go back to sleeping through the night. If you're making frequent trips to the bathroom, especially at night, pay attention. It might be your body trying to warn you that something isn't right. Before we continue with the third symptom, I want to ask a favor. If this information is helpful to you, please leave a like on this video, and if you haven't subscribed to the channel yet, do it now. Every week I share tips like these that can literally save lives. Your subscription helps me continue producing quality health content. And if you know someone who might be experiencing these symptoms, share this video with them. It might be the alert they needed to hear. Now, let's move on to the third symptom that many people completely ignore. Symptom 3. Unexplained fatigue and drowsiness after meals. Do you feel overwhelming tiredness even after a good night's sleep? Or perhaps you notice that after eating, especially a meal rich in carbohydrates, you feel an uncontrollable need to take a nap. Many of us dismiss fatigue as a result of a busy life, stress, or simply aging. And yes, all these factors can contribute to tiredness. But there's a crucial biological explanation for diabetes-related fatigue that you need to know. Normally, when you eat, your body converts food into glucose, which your cells use as energy. This glucose enters the cells with the help of insulin, a hormone produced by the pancreas. But if you're developing insulin resistance, a precursor to type 2 diabetes, your cells can't properly absorb glucose, even with insulin present. The result? Your cells are literally starving for energy, even when there's an abundance of glucose in your blood. It's like dying of thirst while floating in the middle of the ocean. Water is everywhere, but you can't drink it. This phenomenon explains why people with high blood sugar levels often feel extreme fatigue, especially after meals when glucose levels rise even further. Jennifer, a 47-year-old nurse and mother of 3, had been struggling with debilitating fatigue for months. She attributed it to her busy schedule and shift work. What finally made her seek help was realizing that her tiredness dramatically worsened after lunch, often forcing her to take a nap in her car before returning to work. A simple glycated hemoglobin test revealed consistently high blood sugar levels over the past 3 months. A 2018 study published in Diabetes Care found that unexplained fatigue was present in more than 70% of patients up to 2 years before the official diagnosis of type 2 diabetes. If you're struggling with fatigue that seems to have no explanation, especially if it worsens after meals, don't ignore it. Your body might be trying to tell you something important. Symptom 4. Tingling or numbness in hands and feet. Have you ever felt that strange pins and needles sensation in your fingers or feet? Or perhaps numbness that comes and goes, especially at night? Most people attribute this to poor posture, staying in the same position for too long, or maybe a night of sleep in an uncomfortable position. And yes, all of these can be valid causes. But if this tingling or numbness is becoming more frequent or more intense over time, it could be a sign of nerve damage caused by high blood sugar levels, a condition we call diabetic neuropathy. Here's what happens. Excess glucose in the blood can damage the small blood vessels that feed your nerves, especially in extremities like fingers and toes. When these nerves don't receive enough oxygen and nutrients, they start to malfunction, resulting in strange sensations like tingling, burning, or numbness. The scariest part? This nerve damage can begin long before the official diagnosis of diabetes. In fact, research published in the Journal of Diabetes Investigation showed that up to 25% of people already have some degree of neuropathy at the time of diagnosis of type 2 diabetes. David, a 59-year-old carpenter, ignored the tingling in his feet for almost a year, thinking it was the result of long hours standing. When he finally came to see me, we discovered his blood sugar had been elevated for so long that nerve damage was already advanced. With intensive treatment, we managed to control the progression of the damage, but unfortunately, some of the sensations persisted. David's story isn't unusual. What many people don't realize is that unlike other symptoms that may improve quickly after controlling blood sugar, nerve damage can be permanent if not treated in time. If you're noticing tingling or numbness, especially if it's getting worse or affecting your quality of life, don't wait. A simple blood test can detect high blood sugar levels before the damage becomes irreversible. Symptom 5. Slow healing of wounds and recurring infections. And now, we come to the fifth and perhaps most revealing symptom: slow healing of wounds and infections that seem not to go away. Have you noticed that a small cut on your toe takes weeks to heal completely? Or perhaps you're dealing with recurring skin infections, urinary tract infections, or candidiasis, thrush, that simply don't respond to the usual treatments. These aren't just coincidences or bad luck. High blood sugar levels significantly compromise your immune system and impair your body's natural healing process. Here's why: excess glucose in the blood damages blood vessels, reducing blood flow to areas that need to heal. Less blood means less oxygen and essential nutrients to repair damaged tissue. Additionally, high blood sugar levels interfere with the function of white blood cells, your defense cells, making your body less efficient at fighting infections. The result: wounds that take much longer to heal and infections that your body has difficulty effectively fighting. This is the information that literally saved the lives of dozens of my patients. If you notice that small wounds are taking more than 2 to 3 weeks to heal completely, see a doctor immediately for a blood glucose test. Don't wait for the situation to worsen. Maria, a 67-year-old retired teacher, came to my office with a small cut between her toes that hadn't healed for almost 2 months. She had tried various creams and antibiotics without success. When we tested her blood sugar, it was 286 milligrams per deciliter, dangerously high. With aggressive diabetes treatment, the wound finally began to heal. Maria's case isn't unusual. An impressive study published in the New England Journal of Medicine found that up to 82% of patients with diabetic foot ulcers had no previous diagnosis of diabetes. They only discovered the condition when compromised healing led them to seek medical help. This is the symptom that concerns me most as a doctor, because a simple untreated wound in someone with undiagnosed diabetes can lead to serious complications, including amputations in extreme cases. How to check if you're at risk. If you've identified one or more of these symptoms, don't panic, but don't ignore them either. Here are 3 steps you can take today. 1. Schedule a blood test. Specifically ask for a fasting blood glucose test and glycated hemoglobin, HbA1c. The first shows your sugar level at the time of the test, while the second provides a view of the last 3 months. 2. Monitor your symptoms. Keep a simple diary noting when you feel excessive thirst, fatigue, or any other symptom we mentioned. This data will be very useful for your doctor. 3. Evaluate your lifestyle. Even before diagnosis, making small changes can help. Add more movement to your day, reduce processed foods and sugars, and prioritize sleep. These simple changes can have a significant impact on your blood sugar levels. Remember, diabetes is a serious condition, but completely manageable if detected early. The real danger lies in not knowing you have it. As I always tell my patients, knowledge is power, especially when it comes to your health. By knowing these 5 seemingly harmless signs: constant thirst, frequent urination, unexplained fatigue, tingling in the extremities, and slow healing, you have the power to detect diabetes before it causes serious damage. Carlos, a 52-year-old patient, saw this same type of information on a TV program and decided to get a checkup, even without obvious symptoms. The test revealed he was in a pre-diabetic stage. With changes in diet and lifestyle, he was able to completely reverse his condition in less than 6 months. Today, 4 years later, his blood sugar levels remain normal. Don't wait until it's too late. If you identified with anything I mentioned today, take action now. Your future health will thank you. And if this video was helpful to you, don't forget to leave your comment below sharing which of these symptoms surprised you the most. Your feedback helps me create content that's increasingly relevant to you. This is Dr. Mike, always working to help you live your best life, no matter your age. Until the next video. Sources and scientific basis. The information presented in this video is based on various scientific studies and clinical guidelines, including American Diabetes Association, Standards of Medical Care in Diabetes, Diabetes Care, 2023, International Diabetes Federation, IDF Diabetes Atlas, 10th edition, 2021, a Journal of Diabetes Research, Early Warning Signs of Diabetes, Risk Factors and Symptoms Preceding Diagnosis, 2019, a New England Journal of Medicine, Diabetic Foot Ulcers and Their Recurrence, 2017, a Journal of Diabetes Investigation, Prevalence of Diabetic Peripheral Neuropathy and its Relation to Glycemic Control and Potential Risk Factors, 2020, a Diabetes Care, Fatigue as a Precursor to Diabetes, a Prospective Study, 2018,